Welcome to the World Wire Update Yet. Don't forget to subscribe and click the bell icon for more updates and thrilling short scenes. Across the U.S., the corner drugstore, a staple of American life for generations, is vanishing at a staggering pace, leaving a void in communities both large and small. Thousands of pharmacies, from well-known national chains to long-standing independent stores, have shuttered their doors in recent years. This wave of closures has left countless neighborhoods without easy access to essential medicines, over-the-counter remedies, and the trusted health advice that pharmacists provide. In just 2 years, over 13,000 pharmacy jobs have disappeared, marking a nearly 10% contraction in the workforce. This is the lowest level of pharmacy employment seen in more than a decade, affecting not just pharmacists, but technicians and support staff as well. Storefronts now display store closing signs and going out of business banners, a visible symptom of a broken business model that can no longer sustain itself in today's healthcare landscape. This isn't just a big city or rural issue, it's a nationwide crisis. Independent pharmacies in particular are struggling to survive, but even urban communities are feeling the impact as local options dwindle. The loss of these pharmacies means more than a longer drive for medication. It's the disappearance of personalized care, a familiar face, and a trusted local resource that many people have relied on for years. As of September 2025, projections show the crisis worsening, with more communities becoming pharmacy deserts, areas with little or no pharmacy access. This especially impacts the elderly, people with chronic conditions, and those without reliable transportation. Each closure tears at the nation's healthcare safety net, deepening the gap in care. Understanding the financial forces and policy decisions behind this crisis is crucial if we hope to find real solutions and restore access to vital pharmacy services. The root of the crisis facing drugstores today is fundamentally financial, and it's affecting communities across the country. Pharmacies are often reimbursed less for medications than what they pay to acquire them, making it nearly impossible to stay profitable on prescription sales alone. This problem stems from the power of pharmacy benefit managers, or PBMs, who set opaque, non-negotiable reimbursement rates for most prescriptions, leaving pharmacies with little control over their own finances. 3 PBMs, CVS Caremark, Express Scripts, and Optum Rx, dominate the market, often steering patients to their own affiliated pharmacies and consolidating their influence over the entire prescription drug supply chain. Independent stores and smaller chains are left at a severe disadvantage, unable to compete on an uneven playing field where the rules are set by their competitors. The result? Even as some pharmacies fill more prescriptions than ever, they lose money, sometimes over $100,000 a year, because reimbursements simply don't cover the true costs of doing business. Major chains aren't immune. Rite Aid's bankruptcy and mass closures are a direct result of these unsustainable economics, and other big names are feeling the pressure too. The problem isn't a lack of demand or poor management, but a system where dispensing prescriptions has become a losing proposition for nearly everyone involved. This relentless financial squeeze is pushing both big and small drugstores over the brink, leaving entire neighborhoods without easy access to essential medications and care. Until the payment model changes and pharmacies are fairly compensated, the closures will continue, and the consequences will ripple through communities everywhere. Pennsylvania stands as a stark example of the growing pharmacy crisis in America, where access to essential medications is slipping away for many residents. The state has lost more than 800 pharmacies between 2020 and mid-2025, a staggering number that has left entire communities scrambling for alternatives. The collapse has hit rural areas the hardest, where small towns often depended on a single pharmacy for all their healthcare needs. But the pain isn't limited to rural communities. Urban and suburban neighborhoods across Pennsylvania have also felt the impact, with closures affecting people from all walks of life. The bankruptcy of Rite Aid, once a major pharmacy chain in the state, has only accelerated the trend, slashing its presence to just 230 stores statewide and leaving many areas without a nearby option. Each closure disrupts care for thousands of Pennsylvanians, especially seniors, people with disabilities, and those with limited transportation who relied on their neighborhood pharmacy for prescriptions and advice. State leaders, including Governor Josh Shapiro, have pointed to pharmacy benefit managers, or PBMs, as a major cause, accusing them of imposing unsustainably low reimbursement rates and steering business toward their own affiliated pharmacies. The result has been a rapid expansion of pharmacy deserts, with more and more Pennsylvanians forced to travel long distances just to access basic healthcare and fill their prescriptions. In some rural counties, a single pharmacy closure can mean a 30 or even 40-minute drive to the nearest open location, a major barrier for families, the elderly, and those without reliable transportation. Vulnerable populations are hit hardest, turning what should be a simple trip for medication into a logistical nightmare and putting their health at even greater risk. When a pharmacy closes, it's more than a lost business. It's a blow to community health. For many, the local pharmacist is the most accessible healthcare professional, offering advice, immunizations, and chronic disease management. Pharmacy deserts lead to medication non-adherence, as patients struggle with long travel times or lack of transportation. Skipping or delaying medication can mean serious complications, more ER visits, and hospitalizations, especially for seniors. Low-income and minority communities are disproportionately affected, deepening existing health disparities. Pharmacies are more than pill dispensers. They're community health hubs, providing vaccines, screenings, and education. When these close, residents lose convenient access to preventative care, pushing more people to crowded doctors' offices or ERs. The ripple effects weaken the health and resilience of entire communities. The loss of a single pharmacy can set off a chain reaction of poorer health outcomes. As retail pharmacies collapse, hospitals are hiring more pharmacists than ever. In 2024, hospital pharmacist jobs surged by nearly 7,000, a 7.3% jump, while retail jobs vanished. Hospitals are expanding into specialty pharmacy, dispensing high-cost drugs for complex conditions, and capturing new revenue streams. This shift offers pharmacists more clinical roles and better integration with healthcare teams. But as talent and investment flow to hospitals, community pharmacies are left to wither, worsening access for millions. The profession is being reshaped: fewer jobs at the corner drugstore, more inside hospital walls. For patients, this means less local care and more fragmented access to essential medications. The transformation is profound, and not without consequences for public health. For pharmacists, the job market is shrinking and wages aren't keeping up with inflation. Over 13,000 retail pharmacy jobs disappeared in 2 years, flooding the market with experienced professionals and intensifying competition. Average pharmacist salaries rose just 1.8% in 2024, while inflation climbed 3.3%, meaning real wages fell. Retail pharmacists saw the slowest wage growth, with some earning less than the year before when adjusted for inflation. Hospital pharmacists fared slightly better, but the divide within the profession is growing. Fewer jobs, stagnant pay, and stressful working conditions are driving burnout and turnover. Many pharmacists entered the field for stability and patient care, but now face corporate downsizing and eroding compensation. This environment threatens not just pharmacists' well-being, but also patient safety and the quality of care. Lawmakers are finally taking notice, focusing on regulating PBMs, the middlemen blamed for much of the crisis. States like Pennsylvania have passed laws requiring PBM transparency, but many say these steps don't address the core issue: unsustainable reimbursement rates. New proposals aim to set minimum payment rates for pharmacies, ensuring they at least break even on prescriptions. Reform is tough. PBMs have powerful lobbyists and argue their practices keep drug costs down. Real change will require a broad coalition of pharmacy owners, patient advocates, and lawmakers. The goal: a business model where pharmacies are fairly compensated for their services. Without decisive action, pharmacy closures will accelerate, deepening healthcare gaps, especially in rural and underserved areas. The future of America's corner drugstore depends on finding a sustainable solution before it's too late.